Together with your surgeon, you have discussed an inguinal hernia repair using keyhole surgery. In medical terms, this is called a TEP. The goal of the hernia repair is to relieve your symptoms and to reinforce the weakened area with a mesh. A hernia repair may be recommended if you experience pain or discomfort from the hernia. A hernia repair can be done with keyhole surgery or through an incision just above the groin. A keyhole hernia repair is performed in the operating room and takes approximately 45 minutes. Once the anesthesia has fully taken effect, your lower abdomen and groin will be disinfected and covered with sterile drapes. Your surgeon will first insert a small camera just below your navel. Then, 2 more small instruments will be inserted. The hernia will be repositioned inside the abdomen, and a special mesh will be placed to reinforce the weak area in the groin. Once the mesh is in place, your surgeon will remove the instruments and close the small incisions with dissolvable stitches. If the hernia repair goes smoothly, you can usually go home after a few hours.